Welcome to the Doctor and the Dogman podcast, episode 1. I think there's so much misinformation out there.
Yeah, for sure.
That I just think, and there's too much agenda pushing.
Yes.
There's too many out there. This is the only way to think. That's the only way to think. Yeah. This is right, that's wrong. It's just not helping people.
No.
And I see it all the time. I see people talking about certain things and it's just they don't see the full picture.
No, it's an exciting opportunity, both with somebody who, in myself that's keen to look at maybe research that I don't look at traditionally or look into topics that maybe I wouldn't normally do, professionally or personally, until needing to train or look at different kind of dog breeds and types. And also for yourself who works in a space where you see this all the time, you're around this all the time, and actually to give people advice, support, information that then will equip them to make, the best decisions, I suppose, for themselves and the dog. So
I thought it was a good idea, and you said a couple of weeks ago, let's just pick a couple of subjects to talk about.
Yep.
We decided,
yep.
And then it's like, right, we'll go and see in a couple of weeks and we'll film it.
Yep, so I'm Dr. Jodie Ventry. I work in the space of being a research scientist for a university in the UK, but not in sort of dog behaviour, more in human behaviour and also ageing more specifically. So coming to this with a research background and ability and skill set to kind of read research papers that might be of relevance to people and also of relevance to me as, soon to be new dog owner, but also with no specialisms, unlike yourself.
I do dogs day in, day out. I train them, I breed them. So yeah, I'm with them all the time, and I see an awful lot of the reality. You've got the science of the dog side, and we've got the reality because we see what people are thinking, and we get those the feedback from people when they are coming to see us about puppies or they're coming to us about training. It's a massive a massive amount of information. A lot of it is incorrect.
Yes.
People are picking up the wrong information, and the amount of times that we have to say that's not exactly correct, and they're setting off on their journey with their new dog or on their training to change their dog with the wrong training that's gone before. So
more importantly, you need to introduce you.
Yeah, I just do the dog. I'm Jason Blackford. I just do dogs. I breed. I'm a licensed breeder, and I do a lot of training with people and their dogs. Simple and straightforward as that, really.
Tirelessly, round the clock, no days off.
No days off, 7 days a week, 365 days a year, yeah.
Supporting people like me that go, I think getting a dog would be a really good idea and a fantastic addition to my life, and actually maybe the realities of it are, more important and more poignant than we give credit to in that early stage.
Well, I think the thing is this, like, with your, I've not seen you, for 2 weeks?
Yeah.
2 weeks. So how's that puppy journey gone with you? Have you bought everything you need in the shops, or?
Yeah. Have we been out and bought everything that we possibly need? Yes, probably. Although, what do you need? The first question, actually. I think it's important to say, I have been a dog owner before, of a dog, partly motivating why I want to do this, of a dog that journey, lifespan, medical conditions did not go, as you would expect when you become a first-time dog owner. That was my first dog. So I think doing it a second time, you're almost back to square one again, really. But out to the shops, buying everything that you think you need, probably 50% of the stuff you buy you don't need. But I think important to note that there becomes a level of realisation and reality, doesn't there, when you're getting a dog, from the minute you think you want to get one, from the research that you do about the breeder that you align with, want to select based on, several reasons, which I'm sure we'll cover over, the coming weeks or whatever. But and then the reality of when your puppy's born, to then becoming almost a dog parent again is quite, somewhat. You have a sense of realisation, and it does bring a sense of, I think, organic anxiety about whether you're going to make a good job of it. I know some people would be different. Maybe they feel like they take it to it like a duck to water, but it's important to me to make the right decisions and make the right choices with training and caring for the dog and
Because your dog got quite sick quite early, didn't it, your first one?
Yeah, so he did. So our dog Kobe, so he was a Jack Russell Terrier. He was diagnosed very early on, probably 18 months to 2 years into his life, with hip dysplasia. The kind of ball and sockets of his hips, and in terms of his kind of pelvis, weren't formed, I don't think, from birth as they should have been. He had some bulging discs along several kind of vertebrae in the spine, and that presented itself in a variety of different kind of behaviours, and also, you know, limiting activity for him, which was more important, which took us on a very long and difficult path until he was almost 6, of trying to navigate that as a dog owner with no prior knowledge about how to manage conditions such as those. When, you know, you're constantly battling with the thoughts and feelings of, is this even, you know, appropriate as a dog owner to have a dog that is suffering? Who can tell you that? The dog can't, can they? And it manifests in behaviours that maybe first-time dog owners would never expect to see.
What sort of things were you getting?
So at first, I think he was, in terms of his physical demeanour, he was showing lameness, which obviously he's, you know, every time he woke up in the morning from a very young puppy, he was spending a lot of time coming out of his crate, stretching extensively, which we always thought was a bit strange. It was like any time he was kind of stationary for a long period of time. It took a long time for him to kind of get going, which I think when we'd observed other dogs of the same age, that wasn't present. Yeah. Then after that, he became, particularly towards his hips and his back legs, he a real dislike to being touched, being groomed, being bathed if he needed to after.
So the physical pain was quite strong for him then, do you think?
I think the physical pain was probably the first thing that we noticed, actually, in the behaviour. And because then actually, as time went on, and as I say, he's still a relatively young dog at this point, you know, he's sort of 18 months old, and he's showing a real dislike to being handled in any way, which then I suppose you start to investigate that as a dog owner, but then you've got a dog that isn't particularly able to be handled by you or a vet either, which is really difficult, because you're looking to the people that have done the training to know what to do next as a dog owner. But then we had a dog that was particularly hostile towards vets as well.
Just so it was everybody in general?
Everybody in general, but the main issue was the unpredictability of the behaviour, because...
And where did the vets take you with that? Was that sort of, did they have a plan for what they were going to do, or...?
So initially when we went, it was probably a little bit dismissed. As I say, he was relatively young. I don't think anybody could foresee where the end kind of result would be. And I would say actually at the outset, it was quite dismissed, which was a shame for Kobe, because it took a long time of being quite persistent as a dog owner who you would hope you know your own dog behaviours, and the fact that you can notice in the home that they've significantly changed. Yeah, so it actually resulted in maybe... a little bit of a deviation from our original, maybe, you know, family vet to a little bit more of a specialist vet, you know, somebody that specialises more in terms of, you know, maybe hydrotherapy, physio, maybe more extensive health scans. And it was only that when we sought advice of somebody else, and he had, I think, an MRI or a CT scan at the time, this is when the scans were then sent out, I suppose, to worldwide specialists, and they said, yeah, absolutely, that's, you know, easy to diagnose from medical imaging, really. Yeah. So then there was a treatment plan that came after that, which I don't think anybody really explains to you how long you would expect that to last for, whether that changes, does it worsen. He also was diagnosed with osteoarthritis. I mean, he's 2 years old at this point.
Crikey.
So I've got a dog, I suppose, that I thought would be with me on a 15-year journey. But also I'm a scientist of, you know, humans. Also I'm, you know, an ageing researcher. So I'm an, you know, exercise physiologist by background. I look at kind of human behaviour in terms of psychological changes we make when we're, you know, fearful to things, or we're in pain, or, you know, the things about the ageing process. And I really enjoy my work working with older adults, but what comes with that is sometimes discussing things like osteoarthritis or...
So you sort of had a bit of an insight into...
So when somebody said to me, he's got arthritis at 2 or 3, I thought, usually this is quite a progressive thing, but also something that happens, in later life years of both humans and dogs, which in some ways... doesn't always end in, it's not always a great quality of life for people unless appropriately managed or, supported. So we had that on top of that. And I thought, you start to immediately think, is this going to be a possibility for this dog to be 15 and healthy, or as you would expect of a dog with no other health conditions?
You have to look at it and just go, seriously, it's not a chance, is it? When they're that young and they've got those real problems with them.
Yeah, and I think for him more so, you feel a real sense of responsibility, don't you, as a dog owner, to give your dog. I think nobody ever sets out to buy a dog that then has a difficult or a bad quality of life. No, or you would hope not.
No, you want them to be able to run and do dog stuff.
Yeah.
And when they're struggling to do that, it does impact on you badly.
Yeah, and his personality, as I suppose for anybody out there that has Jack Russell Terriers, they're outgoing, they're inquisitive, they explore, but equally they're vibrant in their personality and can be, quite, they give you a lot of character and a lot of joy, but actually for that to be masked sometimes by pain or, things that had happened, is difficult to see, but they're a huge part of your family by that point. So the scales are obviously not very well balanced in terms of the decisions that you make, but actually you think, they're as much of a part of my family as any other member. So it's a real then heart and head kind of, how do we best manage this moving forward, which is really difficult. So that's when it went on to kind of different types. It predominantly, as much as we went down the path of kind of hydrotherapy and sort of physical therapy, immediately it's medicated, which I don't think I realised at the time.
Medicated?
Could have been avoided. So he was on, immediately he began Librela injections, which was quite a new drug, I think, at the time, maybe 4 or 5 years ago, or not necessarily new, but in the UK wasn't licensed to be given by all vet surgeries, I don't think, at the time.
Okay, because a lot of these drugs are human derived, aren't they?
Yes.
So you're basically, there's no clinical tests for them.
Yeah.
There is no long-term tests to show the impact on these drugs and the implications of these drugs on the dog.
Yeah.
So we are running into really unknown territory now.
Yes. We're in a space where, naively, many people do, and I don't mind being honest, you go out to buy a dog for you to give a dog a lovely life and a nice home, and also for that to add something to your life, and now you find yourself in a territory where the reality is very different to that. I think if, you're a dog owner that is committed, to being a hopefully a good dog parent, this is something that you navigate. And the same with, as I suppose, any kind of walk of life, you can never predict these things. Yeah. So you're on this journey then where you're thinking, okay, this is what we're working with and we have to make the best of this situation. So he was on sort of monthly injections, but you've got to remember, we're going back to, this is a dog that doesn't like the vet.
Of course. So
so we're now there monthly now.
Getting him at the vets and trying to get it solved.
So we're there monthly with a dog that every time they go, they have an injection.
So they're building up mental pictures of every time I go they do something bad to me. So your dog's getting worse every time.
So then we're anxious every month. And that day comes round in 30 or 31 very quickly.
Yes.
It's 12 times a year, but it's not. It's
I know what you mean with that stuff. It really does. Yeah. But the anxiety builds up.
Yes.
And it doesn't really leave you, after the couple of days when you have the injection, and the anxiety leaves you then because it's over, it's done.
We've done it for another month.
And then all of a sudden, a couple of days later, it starts to build because we're going back there again.
Yeah. And the problem is, I suppose, we are both the best things sometimes for our dogs and the worst. I was never a dog owner that was going to expect somebody else to take my dog for him to go through any of that. But also, there's anxieties there that you can't, as much as you tell yourself they shouldn't be there and that he will pick up on that, it's not just you can't switch that off.
Well, a lot of them are that we don't know we're transmitting. We don't know we're transmitting.
So there was probably something I was doing, and he was picking up on it. Probably if somebody else would have taken him, he might have stood a better chance of getting on with the vet a bit better. So I'm also open to that. But we're now at a stage, so we're going every month. So then we go every month, and then we have that difficult conversation with. So this isn't our family vet. This is a specialist clinic.
When you've been developed onto.
So, which was actually recommended by a dog behaviourist. Actually, let's kind of go back to that.
Okay.
Yeah, I forgot one of the main points. Yeah. So he was displaying behaviours in the house that we sought some advice.
Go on. Go on.
Yeah. So he was displaying these behaviours in the house. We'd gone to the vets about the lameness. No, we're not seeing the same things. Okay. So then I thought maybe it's something we've done as first-time dog owners. Okay. So we consulted a local dog behaviourist.
How did you find that person, by the way?
It was recommended by the vet.
And were they qualified? Were they just somebody who said, I'm a dog behaviourist?
Who knows?
Okay.
Yeah. The more I think and the more I'm a bit invested in these things that interest me now, the more I think, what are we looking for as dog owners to quantify how best placed somebody is to give us that advice? We're putting trust, aren't we, in people?
Well, you're looking for an end result. You're looking to say, speak to these 3 people. These people have
told you it works.
Told you that this guy is good or this woman is good. They solved my problem. My dog was like this and they fixed it.
Yeah.
That's what you're looking for in a trainer or a behaviourist.
Yeah.
But we don't, do we?
No, and in the moment, I think you're in it, aren't you? You're in the moment of.
And you trust your vet.
Yeah.
They must know that they're a good person because the vet's recommended them.
So interestingly, it goes full circle because what happens is the vet goes, let's not broach this subject of lameness just yet, because once we say this is what it is, if it isn't, there'll be insurance problems. There's other things, there's this, there's that and the other. So you go, okay, there's no problem physically. Okay, when I touch the dog, it doesn't like being touched in the vets, but that's not because there's a physical problem, it's because the dog doesn't like being touched in the vet. So I think you need to speak to a behaviourist, and we know a really good one. So we go to a behaviourist nearby, and the behaviourist says, okay, there's a few things that, you probably could have trained a little bit differently, but I think there's something physically wrong.
Okay,
so I say, actually, there's some level of validation there.
Yes.
Because I can see that.
Yeah, they're not just trying to we do this protocol to stop the aggression. Or
It's not, and I respected that. It's not, buy 6 sessions off me and I'll have your dog fixed.
Yes.
Because the first thing that the dog behaviourist said, he walked into the house and he said, Kobe was lay a certain way. And he said,
that's not right.
Dogs of his age don't lie like that, normally. And he got up from being laid down and he stretched extensively like he always did. And he said, I think there's physically something wrong. And I would be not a good dog behaviourist to you if I said, okay, let's put him through his paces and do all of these things. And still at the end, there's no result. And actually, if you take him to a suggested other place, check.
Well, that's good news. That's good news.
very good.
Yeah.
No problem there. So actually, no level of kind of behaviour intervention was neat. We didn't get to that point. So I said, respected that. So we went. Physical problem. So now we're back at the specialist centre for these sorts of things. So now we're going every month, and Kobe doesn't like going every month. He wouldn't like going every 6 months, and every year for an annual vaccination would have been hard work, but we're working on it. So then you get to the difficult conversation where we found out that there's a physical problem with your dog that needs intervention medically. Okay, but he's come for 3 months on the run now, and he's getting progressively worse in his behaviour as he comes. So we've got this association that nothing good ever happens to me at this place. Also, it's over half an hour away in the car, so that's never had a problem travelling in the car, but this is going to make more sense when I kind of go into the next story. You can't bring him again unless he's muzzled, because he's showing levels of aggression now because he doesn't like coming here. Okay. We've got a renewed enthusiasm. Okay, right. So I'm now thinking, okay, you've just given him his injection. We know we're here. We've got a follow-in appointment, and he has to have these injections monthly. And what I would say is, in the short term, we begin to notice changes. So you're buying into the idea that it's helping him because his behaviour is changing and he seems less in pain, and we're not doing long walks now, we're doing shorter, and we're trying to follow the guidance, that's fine. And so he seems better in himself in an immediate response to the medication. But now I'm thinking, everything you read online about muzzle training, am I going to train him sufficiently in muzzle training for a dog that's never worn a muzzle to get him back to his appointment in a month's time? Because they won't see him or give him that treatment again unless he goes in a muzzle the next time. So in remembrance of Kobe, super bright, you know, there's no kind of there's no getting around dogs when they know. So what then happened is I went down the idea that we can't just start. If I'd have just in 30 days time put a muzzle on him, he would have let me put a muzzle on him. But then if I'd have only put a muzzle on him once a month and taken him there, the association of the muzzle only goes on when I go there.
Correct.
And that's
You're just building up another layer to the dog predicting what's going to happen. I'm learning by association. The muzzle goes on, we get in the car, we go to that horrible place again. It just goes back and up.
The anxiety just starts, and the days of anxiety for us start earlier. So you invest in, you know, you've got to do the right thing. So we did the muzzle training, but still, he very quickly realised that even if they put the muzzle on me and take me out, because they had to kind of put the muzzle on him, take him out in the car, so that then they put the muzzle on me in the house, or they put the muzzle on me and take me for a walk, but the only time they put the muzzle on me and put me in the car is when then I go to that place. So then you're muzzling and in the car, and that to make sure that every single time he's muzzled in and in the car, it's not just to go to there. But in the back of your mind, you're thinking, whatever this is, it's anxiety inducing for him as well, surely, because it's all a change to how his normal life was prior to the diagnosis of all of these things. And for one reason or another, even though we tried all of these things, we got to the situation where to have him muzzled, in the car muzzled for 30 minutes there's times where I'd go through that process, get him muzzled, get him there, and for some reason, when he went in, always went into the room without me because I wasn't a good influence on, you know, his behaviour. He would slip his muzzle or something would happen and they'd go, we can't do this, you know. And I would always say, as a responsible dog owner, I absolutely would never expect you to try to treat my dog and get bitten or, you know, these things. That's not what I would want you to do. There's no expectation. But then that means that Kobe isn't getting the treatment that he should be getting. So then he's coming away then, and I'm thinking, but now am I to worry that he's in pain because they haven't been able to do it, because he's got his muzzle off, or he's been, you know, wriggling around. So then we go down the route of, because our local vets, which literally is 5 seconds across the road from where we live, doesn't do this treatment at the moment. It's not, whether there's not a big enough supply or whether not enough people are, you know, able to give this drug at this time, which I think was significantly progressed in the time when we had Kobe and our local vets was then able to do it. But then we go on to the sedative medication for the vet appointments then.
Wow, so it's just getting more and more.
So we're just getting further down a rabbit hole. And it's not sedative medications to help his condition, you know, remember. It's just to help the vet get this said drug into him. But then I'm starting to think, as a dog owner, this is quickly escalating quite seriously in terms of, you know, he was 7 kilos. He's tiny, you know, he's really tiny. To me, he's tiny. Yes. You know, this is a lot of drugs on now more than one occasion per month when he's never taken anything before. Not even to improve a physical condition, to manage behaviours, which never sits well with me. I think as a dog owner, you want to be responsible enough that you can manage behaviour through training or, you know, anything else, that then that's not needed. But he was too in need of the treatment and we were too far down the line.
Well, you've got to look at his behaviour is spun out of him feeling pain. You touch him, it's painful, leave me alone. You know, if I've got a bad arm and you're trying to, you know, oi, 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 I'm going to like, get off. And that's where it comes from. Yeah. But then he's making the association that you are going to be rough with me, you're going to stick this needle in me, and it's not good. So you can't really knock the dog for being defensive for his own personal security and safety, really. Keep away from me, you're going to hurt me.
I've done phlebotomy training for research projects, and I do not like needles. for some reason, I wouldn't say it was a phobia. I just don't like them. I could take blood from other people, take blood from me, and I just don't like it. I don't like the sensation. I don't like the idea of it. I know it's for the greater good, but it never feels that way, you know. And in the interest of research, I'm like, come on, Jodie, get your head around it. So I thought, do you know what, actually, if nobody spoke my language, they took me to somewhere every month and somebody got a needle out and never explained to me what it was for, and that kept happening to me, and it was just a negative experience every single time I went, I'd start maybe acting in a way where I would try and get away from that.
You've just hit the nail on the head. We have a dog that doesn't speak our language. Not only does it not speak our language, it communicates completely differently. Yeah. We communicate verbally, they communicate through body language and signals that the bodies are giving out. And we then wonder why, with that basic misunderstanding that the dog communicates one way and we try to communicate another, as to why doesn't my dog understand me? Why is he doing this? What's all that all about? Yeah. Because there is a disconnect between the owner and the dog. Yeah.
But there's a level of frustration because you think there's a level of frustration because it's not quite going right. But there's also a level that sits quite heavily, I think, with the dog owner that goes, I'm supposed to be able to help you and I can't. And this is, you know, when I looked at dog training and dog behaviour previously in terms of getting a Jack Russell puppy, and you'll read a lot online about, is it the dog for you? And maybe not, and maybe there's more research that could have been done, and we didn't live on a big farm, and, you know, and things like that, that they seem to kind of, you know, have great lives in open spaces, and they kind of a bit, you know, got free reign. You know, we didn't, it's almost like a domestic pet, isn't it? But actually...
Well, so many are.
Yeah.
You know, there's how many pointers out there that live in homes actually go out and point, you know, in the field doing their job. How many spaniels are actually hunting? How many retrievers are going out and picking up birds from... Yeah. It's not happening. Yeah. You know, they were a retriever ball, but it's not what they're built for.
Yeah, and I think there's also, you know, an importance around that, which, you know, hopefully, you know, you kind of do your research then always a second time and think, actually, what kind of would be suited to me and my lifestyle better. So there's an element of that, but there's also a thing of, when your dog needs immediate treatment, but you've invested in training previously that tells you nothing is going to be fixed overnight, you understand that these behaviours then that are starting to be displayed, you're not going to be able to help them as quickly as you would hope, because every behaviour that then, you know, maybe from a, you know, a negative reinforcement or a negative experience, it probably takes 1,000,000 times as many days to improve that than it ever did to generate that sort of behaviour. So we knew that when they say, okay, well, muzzle him in 30 days and bring him back, to muzzle train a dog, really, if you're looking at the appropriate way to do it and to do it appropriate, you know.
But also, muzzle train the dog in 30 days is not a training plan for you.
No.
It's not sort of, this is what you need to do day 1, day 2, day 3, day 4.
It's just go away and see what...
Figure it out.
See what the internet says about how to do this. So in terms of rounding up on that story, you know, it gets to a point where then there's a lot of medication.
Poor little fella.
Yeah. There's a lot of medication on top of the medication that even is needed for the physical, you know, for the condition, which only ever sits heavier and heavier and heavier on a dog owner, because that's not what you get a dog for. To have a dog with you that is so heavily medicated, they're not who they are.
No.
You know, it went from maybe a Librela injection to then some level of, you know, Metacalm or some sedative. I think I remember the name of one. Then we got to gabapentin for either sedation or pain management. I can't quite remember. Then it was...
Now that's the first time we spoke, isn't it? Because I'd done a video live about medicating your dog and how horrendous the problem is.
Yes.
And you rang me, didn't you? Because you saw that.
I did. And I said, I can't believe you've released this, because actually this is what happened to me. And at the time, I was just acting on advice of somebody who said, this is what he needs. This is the type of medication and drug that he needs. And I think the amount of dogs that are on gabapentin or similar...
Yeah. Prozac.
Really prevalent. Yeah.
Well, I'll tell you as a sideline, I had somebody ring me the other day talking about, I want to train my dog for, I don't want it to get anxious, I don't want to have separation anxiety. And she was just saying, what can I do? Can you tell me some things I can do? So I was talking to her, And she said, I spoke to a friend of mine, or say friend of mine, somebody at work, this girl said, and the girl at work said, oh, don't worry about training your dog, don't worry about separation anxiety, just medicate it.
Wow.
And I was on the phone to me, and I'm like, sorry?
Yeah.
And this is not a medical person, this is a dog owner saying, oh, don't worry about training it, if it gets separation anxiety, medicate it. Now, for it to get that bad...
For it to be the first go-to...
Mad.
Should always, if anything, be the last resort, never the first.
Well, your dog's not your dog.
No.
Yeah.
And that's what we really felt with Kobe, that we saw the real him for the first, 18 months to 2 years maybe, and then obviously things started to deteriorate. But then actually what you end up with at 6 and, 7 is not the dog that he should be, that he is. And actually, there was all sorts of recommendations, gabapentin, trazodone I think is another.
Yeah, it's another one.
They were used in combination.
They flatten your dog though, don't they?
Yeah.
They just flatten everything.
Yeah. It's just so completely not in the room. Then there was a recommendation of just cut up normal paracetamol, quarter of paracetamol. If you're on a longer walk than normal, give paracetamol on top of these things. You're buying paracetamol off supermarket shelves and giving your dog powder. Then we've got on top of that different, some other behaviour would appear, because then that pain clearly wasn't being managed, and then it's, well, what else can we add into this concoction? And before you know it, it's twice a day medication, and each 4 or 5 different medications. Ridiculous. You just know in your mind it's not the right thing.
No, it's not. I mean, I'm really against medicating dogs, because a lot of those I can understand it for pain when the dog has got something physically wrong with it. That's a different matter. Yeah. But when you're medicating to modify behaviour, then that's just train your dog. Yeah. And it's a lot easier to give them a tablet or to give them an injection than it is to actually figure out a training plan to stop your dog reacting at other dogs, or bouncing off the windows when other people are walking past. It's much easier just to stick a drug in them, and that's just wrong. How did this then, because you get into this point now and you've got all this happening with Kobe, I mean, has this affected your decision when you were getting a new dog?
Yeah, for sure. I mean, we've been over a year without Kobe now, and to some people that might seem either a long or quite a short period. I've obviously been speaking to you for quite a long time about whether this is the right decision, and been one of those people that in the outset you say, I am never, ever having a dog ever again. Partly from the standpoint of what happened last time. What if that happens to me? How do you cope if that happens a second time? Because you almost don't cope with the first time.
No.
Because it's not what you sign up for, and you look at everybody else, and I know life isn't always what it seems on the outside, but you look at everybody else that has dogs, and this doesn't happen to them, except it does, but nobody, people talk about it in different spaces, I guess, and we've kind of found out more that obviously it does happen to other people, but that's not actually, it shouldn't be the case. Genetically, I'm sure there was some, that doesn't, you meet other Jack Russells in the street and they're not prone, I wouldn't say that the research says they're typically prone to hip dysplasia and these other things.
They're not. Luxating patellas, potentially, but again, with them, it's just a little skip and it's back in. Yeah. That's a Jack Russell skip.
Yeah.
But,
so you're left thinking, how much can you know, or how much can you equip yourself with the knowledge as a dog owner to try and make sure that nothing's ever perfect and no one can ever know 100%, but what can I do? Either I'm not going to have a dog again, or I suppose after so long without a dog, we've said, but we really like a dog in our lives. It adds to our life. Our house feels completely different without a dog. You go home when then you don't have your dog, and your home isn't your home the same. We found ourselves being like, let's just spend loads of time out the house, because the house isn't the same without him, Yeah. So you feel it has like a profound effect on you that you can't ever imagine. And I suppose you can only resonate with other people who have dogs that then, they've been in a situation where, they're no longer with us, or there's other situations. But I think at first your immediate go-to is, I won't own a dog again. And then over time you think, is there more things I can do to say, okay, I really want a dog in my life again? Because actually now I'm, been 7 years with Kobe, and then you think, but I felt that was supposed to be 15 years. I'm at a very different stage in my life. If Kobe had still been here, he'd have been with me until I'm, in my 40s or whatever, and now he's not here. I never imagined to have something so short term.
Yes.
And I know it's the price that we pay for the relationship with them. No time's ever a good time to lose them. But prematurely, when, they've got such health conditions that there's nothing that you could do to make their quality of life better. I would never wish anybody to have to make any sort of decisions based on that. And again, that doesn't come, I don't think, from your vet. Your family vet, I don't believe, ever says to you, enough's enough now. I feel like you have to seek multiple different opinions from specialists and other people that go, look, this is on a downward trajectory here. It's not getting better, actually. In fact, it's getting worse, and his behaviour's getting worse because he's in more pain, and there's no way for us to manage it. He's on the maximum medication he's on. I can't believe the medication has been increased at such a rate already over 4 short years that I'd gone from an injection to maybe 5 medications a day, something like that. And also, you can't, it's difficult as a dog owner to have a dog in your house that behaviour is unpredictable, particularly around children and other guests. And
yes,
that.
That's probably the most difficult thing to handle, I guess, because you can handle, if your dog is, barking at the end of the lead at somebody else, it's okay. But when your dog might turn on you, your family or your guests, it's like it becomes a very different relationship that you have to have.
Yeah, because you don't, I remember a couple of people probably saying to us, you've done really well because other people would have rehomed him, or they say these things. And you think, it isn't that flippant to me, that relationship between me and my dog. That would never be an option. But also I always remember us sitting back and going, how irresponsible would it be to rehome a dog that we actually got to know his behaviours. We actually got to know the things that triggered certain responses, rightly or wrongly. You can't just rehome him because he's got, multiple long-term conditions and maybe, as some people would say, unwanted behaviours, and expect somebody else to deal with that better. It's worse. It's a worse outcome, surely.
What you're saying is that people were saying that to you.
Yeah, so people were saying, other people don't go through this, Have you ever thought about rehoming him and just getting another dog? Starting again, basically.
Yeah, but the problem is that what they're suggesting is that you pass the problem to somebody else.
Yes, which is how it felt.
Which is something that...
It was dangerous. Would have been dangerous for us to do that. But also to...
How many other people do that? How many other people get a dog? I'm not saying physically or potential. Physical problems, behavioural problems. And if that's something that people are freely saying to you when you're in that condition, people are obviously freely thinking it.
Yeah.
So, how many people are actually giving their dog up to a rescue centre knowing that there's problems and going, oh, dog's fine, just can't feed him.
Lifestyle's changed or can't meet its needs.
I work away from home now, so whatever, creating some story, the dog goes.
And I think they were saying it to us in a way that you've done everything, you've persevered, and they were trying to be kind, I think. I think they were looking on and thinking, whoa, what a rough ride this has been.
Must have been a real rough one.
But in a way, I'm thinking this is like my last... If he's not with us, he's not with anybody. Because we've known him from 8 weeks old and can't seem to support this. And we've been with him from day one. We know his behaviours. We know what he likes and doesn't like. We know how we've trained him.
Dog.
He's our dog and he's our family. And I just thought, it's interesting, isn't it, that we have this idea sometimes that, he wasn't replaceable for us and isn't. So then, I look at other people on social media and they go, we don't get a dog after we lose one dog because we feel guilty like we're replacing them, and you're not, you never can, and it's not possible.
We get a lot of that. We've had people who have lost their dog the day previous and they start to look and they see an advert or they know somebody that get in touch with us. And one of the big questions that they always say is that I feel guilty, but I want a dog. And I'm always saying, you can't feel guilty. Yeah. You're not replacing your dog, you never can. No, you can't. But you want that dog in your life. And it's some people will wait years. We've had probably, I'd say the longest, 6 years. Somebody's had 6 years without. Sorry, there's a cow run past the window that's birthing. It's got a calf coming out. That is extremely off-putting. It's birthing. We live in the middle of the country, and we have a cow running past that's birthing. It's just gone down the lane there.
Wow. I mean, there we go. But the beauty of nature, and then we say these things aren't replaceable, they're not. It's like a real world moment of like, this is life, isn't it?
Yeah. I mean, it is. It's just, anyway. But yeah, I think it's a big thing. You have to make that decision to get a dog, or I don't want a dog, but ultimately it is your decision and nobody else should impact on that, because nobody else is living your life.
No. And I think it's definitely an individual thing. I could see how in that, I could 100% resonate with in that moment. You've done your first night without a dog in the home, and you've had a dog in the home for so long, and you go, I actually can't do this. Yeah. Your home doesn't feel how it used to, so you go, I know, actually, a dog's presence is so special. Let's fill that void a little bit. But then I think sometimes when you have a situation that it doesn't go the way you'd hoped, you go, hang on a minute. You've got to kind of take a little pause and go, what if this does happen again? What point am I ready for that?
That's where the impact is, isn't it? That's where I'm guessing that's what the point I was getting to. I guess that's the point of, because you can't, Lisa always says, nature can bowl you a googly, and you can get 2 googlies on the run. Yeah. You could be, I won't be asking you for lottery numbers in the future, but you know what I mean? But that type of thing, it can happen. Yeah. So it does impact you and how your mind is thinking, well, do I get another dog? How do I make sure the dog's healthy? What type of dog do I get? Yeah. And then when you've made your decision, that's all coming flooding back again, I'm guessing.
Which is where we're at. So we go, okay, we're going to do this. We've let go of this idea that, it was all our fault, or...
But it wasn't your fault. It couldn't have been wasn't your fault. Yeah. You did everything you could to help him.
Because you go, why us or why? Yes. As I can imagine people do in a lot of situations in life, when life throws a curveball and you go, why me? Or, and you do that for a very short moment and then you go, come on, let's be realistic now. I mean, I'm a scientist and I'm like, let's look at the probabilities of these things. So I think, okay, right, I've got to kind of get, think about the possibilities of this again. So then you go, actually, I'm going to do things a little bit less, naive, and I'm going to be more proactive, and I'm going to look to ask what are the right questions to ask of a breeder? But you start and you go, okay, I'm going to try and form a relationship or meet a breeder that aligns to what I'm looking for, to try and hope that, there's probably things with Kobe that could have been avoided, but who knows?
Yeah, that's it. It's gone, and it's all right to sit there and say, well, you could have done this, and you could have rewarded that and marked that. You don't know, it's gone. Yeah.
So you go, okay, let's do everything we possibly can so that we're in a mindset that when we bring, our next puppy home, we feel we've done as much as we possibly can to offset some of the things that were out of our control about, health conditions, etc., although I know you're never 100% sure, and then we move forward again. But yeah, back to where we started this from. So, come to you and say, Jason, what do you think? I'm ready to do this again. And you go, I'm so glad, because some people don't. So then we start that conversation over many, many, many months. And then you say to me, right, it's happening, here we go. Here's what you've been waiting for. And then I go, hang on a minute. I'm not sure this is the right decision. Because actually what then happens is the idea of it you're okay with.
The reality of it.
And then a puppy is born that then you go, okay, and I'm going to come and choose a puppy, and you go, actually, that's the one for me, and you have that moment. And initially in that you go, and actually I'm starting to get these feelings again where I'm going to have a dog in my life, and how special is that? And then you go home and then you sit with that thought, and then you have the experience that you had from your previous dog, and you go, oh, what if that? What if that happens again? It's a coping thing, isn't it? And you think, oh no, what if I can't? What if it was anything I could have done differently? And it's so difficult, and I would so be interested to know how many people go, I'm not even going to take the risk. But how many people then live without a dog in their life?
We've come across people whereby they just don't want another dog. Yeah. The pain of them leaving them, and not so much the effort and the stress of looking after them. It's when they go, and that's the thing. I think for most people, it's just that pain is so severe.
Yes.
And yeah, it's a hard thing. To actually then go, crikey, we're going to go do the whole thing again.
Yeah.
But you've got to look at all the joy that you'll get in that lifetime. And, you know, touch wood, you know, in fact, there's wood somewhere. There we go. Touch wood. Find it. Got it. There you go. You're not going to have, you know, you're not going to be that unlucky a second time round.
Yeah.
And granted, you know, I am sure there is potential to avoid problems by, as you say, doing the things looking at the right breeder and asking the right questions to do it. But it's a massive world out there, and there's so many people who are have got different opinions on things. Hence, what we're trying to do is get rid of a lot of that misinformation.
Yeah.
You know, it's not right or wrong with us. It's, you know, let's get rid of the misinformation.
Yeah, where have you heard that from, or what's the idea behind that, isn't it? Where have you formed that opinion from, and what can we do to kind of understand all those avenues?